Thanks, the gentleman. Chair recognizes the gentleman from Georgia, Mr. Carter. 5 minutes for questions, please.
Thank you, Mr. Chairman, and thank all of you for being here. These are very important pieces of legislation, and I appreciate your interest in them. I want to start with Dr. Greenbaum. Dr. Greenbaum, I'm from Georgia as well and served in the Georgia State Legislature, and certainly human trafficking is a problem in a lot of urban areas, but particularly in Atlanta. When I served in the Georgia State Senate, we addressed this, and it's something that we passed legislation on. In fact, a great champion of this has been State Senator Renee Underman, who has passed Rachel's Law and the Safe Harbor Law, and those are very important. And you know, human trafficking is horrific, and it's widespread. And it's in our urban areas. I mean, we think it's, you know, it's not there, but it is there.
Yes.
And oftentimes, the only people that these victims will see will be healthcare professionals. And while the victims are in captivity, and I say captivity, and I mean they are in captivity. I think you all understand that. But how can nurses and doctors, how can they identify? How are we doing any training to help them to identify victims? I know it's very difficult, but are we doing anything? Are there any telltale signs that we can point toward?
We are doing a lot of training for healthcare providers and looking for possible indicators and red flags, and there are some well-known ones. We're also doing some research to actually come up with a screening tool that can be used in a very busy healthcare setting to identify children who are at risk. And we're validating that in a multi-site study out of Children's Healthcare of Atlanta. But we do try very hard to make healthcare providers, nurses and doctors and physician assistants aware of the red flag indicators that might suggest that person is high risk.
You concentrate on emergency rooms or just...
We do a lot of work with emergency rooms, but also with general internists and pediatricians and just about any specialist, especially gynecologists. Also, we'll see a fair number of victims as well. So really we try to educate everybody in the healthcare system.
Mm-hmm. What about the Children's Hospital of Atlanta? Have they done anything that you're aware of? They got any programs like this?
Yes, I think the Institute for Human Trafficking was just funded this year, and we're doing the research I talked about earlier, as well as doing a lot of training of healthcare providers and people who work in the healthcare sector. We do a lot of webinars and on-site trainings, as well as the research into a screening tool for children.
And results, have you seen positive results as a result of this education and
Yes,
efforts?
we've tracked the results of our webinars, and there was large improvements in knowledge and skills, as well as the use of the materials that we train people on in their practice. So people began screening, people began talking to other healthcare providers about human trafficking, which is exactly what we wanted.
Well, I want to thank you for your work because, I want to make sure my colleagues all understand what a big problem this is. It is a serious problem, particularly in international cities, if you will, like Atlanta, where you have so many people coming in like that. It's something we've really struggled with, and I think we've made progress, and I'm very proud of that.
Yes, I think that Georgia's done a whole lot with the issue of human trafficking, partly because Atlanta is such a major.
Exactly. Dr. Watson-Lowry, I wanted to ask you about the dental bill. I know that CDC works with a lot of the local communities, and they have state partners in local communities, and they do a lot to help with water fluoridation and making sure that they have monitoring systems to help the communities monitor their water systems and all. And they also send funds to health departments and for oral education and for different things. So if they're doing this, explain to me the purpose of the partnerships or the contracts that are outlined in this legislation. I mean, are we duplicating things here? Is this necessary, or how's this going to complement that?
Thank you for your question. It's necessary because this is more grassroots. It's local solutions to local problems. Sometimes the CDC is flying up here. We need things on the ground. We need to be able to address the issues that are local in those particular areas and be able to take care of those problems efficiently. The CDHCs are able to, a lot of those the CDHCs are from those particular areas, so they know exactly what the situations are, what the problems are. They can get the patients to those locations, make sure they receive the services, make sure they receive the care that they need. Sometimes it's just difficulty finding the exact location to get the particular service that you need.
Great. Well, thank you for your work. Thank all of you for being here today. This is most important legislation that we're talking about. Mr. Chairman, I yield back.
Gentleman yields back. The chair thanks the gentleman.